Journalism 3380 presents, quote unquote, how to tape an injured ankle. And here with this week's task and guest is your host, Kenny Wallace.
Hi, welcome to the show. I'm Kenny Wallace, and today we're going to be teaching you how to properly tape an injured ankle. And whom I will be demonstrating on is athlete of University of Texas at Tyler, Abeni Ojo. Tell us about yourself, Abeni.
Hi, I'm an athlete at UT Tyler. I'm a nursing major. I've played basketball for about 3 years now, and I just have a lot of ankle injuries for some reason.
So she was saying to me before the show how important it is to have someone who's skilled in this area and knows what they're doing. Otherwise, it can cause injury. So, materials that you're going to need are your white tape, which holds it all together, your pre-wrap, and mine's really girly, so for all you masculine men, there's lots of colors out there, and your blue tape, which you're not going to need. I'm just going to use to demonstrate with. So, first you start with the pre-wrap. Now, first and foremost, you always want to keep the foot and the ankle at a 90-degree angle, which a lot of the time you'll see a trainer have the foot pressed up against them to ensure that that will stay that way. So, you want to start with the pre-wrap and go about lower mid-calf, and you want to tape about 3 layers right here because that's where your tape is going to stop, and you want to avoid chafing of the skin in the tape. So, and then you're going to follow it and go slightly below the toes and do the same thing. All right. So first, we're going to take her foot and wrap 3 layers at the top. Okay? It doesn't have to be pretty because it's just the under layer. And then you're going to follow all the way down. Get it snug, but not too snug. You want to get the whole Achilles tendon and all the way under the heel. Okay? And you remember, you tape 3 at the bottom base too. So 1, 2, 3. All right. Now normally, you would have Band-Aids or something like that to go on top of the pressure points, which are your Achilles tendon. A lot of the time it'll be the ball of your foot. A lot of the time it'll be your heel or the top with the really sensitive skin. But we don't have Band-Aids today, so. All right. Now, the reason why you want to put your pre-wrap all the way up to the calf muscle is because, not because you're taping on it, because that could cause restriction in the calf muscle, but because if your tape is going to start here, you need to have pre-wrap all the way up at the top to avoid this line of the outer tape cutting into the skin. So this is how you would do it. And this is not working. Okay. Tape the top. And just the same as the pre-wrap, you want 3 layers right here. And this is just to demonstrate. So, you want to take your tape, and I'm really bad at tearing it off because I never have good nails to do so. But you're going to start at the top, like so. Always pull out. Don't just wrap around because that can make it too tight. So you wrap around, tear, and then start again. Sometimes you can start the other way. And basically, to start out the tearing process of the tape, you want to do that first, and then this. We're going to take a quick break, and we'll be right back.
Look, Marge, Armory Flea Market, Tyler Fairgrounds, and it looks like the humans are going. Yippee! Let's go too!
Proceeding on West Front Street. Turn onto Rose Park Drive.
Darn!
The Armory Flea Market has something for everyone. Well,
Hi, we're back with the show How to Tape an Injured Ankle with our guest Abeni Ojo. I'm your host Kenny Wallace. And just before the break, I showed you how to properly tape under the tape, which is called pre-wrap. And first, after the pre-wrap, you want 3 layers of tape at the top and 3 at the bottom. These are called anchors. So we have 2 layers of tape at the top right now. So we need 1 more at the top. So tear that off, pat it down. And now you want another anchor at the bottom below the toes. You don't want to put it on top of the toes or too closely to them because it can restrict the toe movement, which also can cause injury. Now also, when you're taping your anchors, you have to be careful with how tight it is because of your plantar fascia tendon at the bottom of your foot. If you tape it too tight, it can cause plantar fasciitis, which causes shooting pains from the toe to the heel or from the heel to your mid-calf, which is not good for any athlete that has to play. Also, if you restrict this tendon too much, it can cause lack of blood flow to the rest of your leg, and it can cut off circulation to your toes. So that wouldn't be good either. So after that, you're going to start with what you call a stirrup. Make sure you keep it at a 90-degree angle. Now it's called a stirrup because it resembles, in baseball, the stirrups they wear that go underneath their foot and over to the side of their ankle. Now when you pull this around to the outside of the ankle, it's going to go remedial to lateral. It's going to go on the outside, and you make sure you do it tightly because, again, this is to prevent ankle injury. So you want to keep this against the ankle on the outside nice and tight. So you do about 3 of those. You need to be tight on the outside, not so tight on the inside. And again, I'm really bad at tearing tape. Okay? And then after you do your stirrups, you do what is called a horseshoe, which resembles a horseshoe. You want to start on the side of the foot, below the pre-wrap, go underneath like you would a horseshoe. Make sure you don't tape too tightly on the Achilles tendon, which is very, very hard to recover from if you injure. So it doesn't really matter which side you start from when you do the horseshoe, as long as it's not too tight on the back tendon. So we're going to get 1 more of those. Okay. Now after that, you're going to do what's called a heel lock. So you're going to start from the middle, which is also the same place you're going to end. Bring it around the heel, like so, and back to where you started. And tear that. And just to show you what that actually looks like, with the blue tape, start from the middle, bring it around the heel and back to the top. So nothing's actually on this side. So just like this. Okay, I'm going to take that blue tape back off and finish the heel lock on the other side. So wrap around the heel and back out to the top. You don't need too many of those because the heel is not as easily injured as the rest. And lastly, you have your figure 8s, which are going to start more where we have not taped yet. You're just going to wrap around like a figure 8. It's kind of ugly at first, but you're going to finish taping down the ugly parts at the end. Okay? And this one you don't have to do break off tape, but you can to make it easier. And you just want to cover these, and we'll talk to you tomorrow.